Blog Talk Radio.
Good morning, everyone. This is Kellie Ann, your host, with Everyday Wisdom for Families radio program. I thank you so much for being a part of us today. And I have a painful topic for us today. Not completely, but anyways, fibromyalgia is our topic. And the reason why I bring it up is I actually have some relatives who suffer greatly with this. And it is very painful for them to have fibromyalgia and not know what to do. And unfortunately, it's one of those medical conditions that often many people believe don't exist. So I thought, let's get an expert on here and have him help explain it to us today. Is it a real diagnosis? If it is, then how would you know that you had it and not something else? So I have brought on Dr. Kevin White today. And Dr. Kevin, you are not only an expert in this field, but you're also an author in this field. So welcome.
Thank you very much. Nice to be here.
So, you know, one of the first things I want to ask you, and I've heard it many times, is that fibromyalgia is just all in your head. So why don't you just help deal with that whole accusation of it's not a real diagnosis?
Well, there are many, many things that I can talk about in terms of that. But I can tell you that this is a mistake that's been made many, many times before with many other illnesses that we now accept as being totally legitimate. Did you know, for example, that multiple sclerosis used to be called progressive psychogenic paralysis? It's true. You go back to 1950, there was a big symposium in New York City where all these hobnobs from around the world got together and sat down and finally decided, okay, I guess it's real. And you could say, well, you know, that was 60 years ago. But the sad news is that there was research done in the 1890s, so 60 years before that proved that it was real. I mean, you could see it on autopsy. You could see when you looked at these people on autopsy that there were actually changes within their brain and within their spinal cords, but it took 60 years. The good news with fibromyalgia is now you have so much communication is so much better with the internet and everything else that the dissemination of information is much, much faster. So hopefully fibromyalgia doesn't have to go through that. But there is so much evidence now that fibromyalgia is real, and I could go on and on. But the biggest piece of evidence is that we can now see it. We can see the pain. We now have the technology to actually see the pain.
Really? Because like I said, I have a relative. She's older than I am, about 10, maybe 15 years older than I am. And so that would put her, closer to her 60s. Mm-hmm. And she has had a heck of a time with fibromyalgia for a majority of her adult life, to the point where she has not even been able to work because of it. I know that often when they would explain it to people, they say, no, this is a real diagnosis, you know, and I was like, that's interesting that they would say that. And everybody goes, well, you look good, you walk around fine, you know what I mean? It's not like you have the flu. And people I have often heard say to them, I think it's just all in her head. They just, you know, she just doesn't want to work, and that's her excuse. And I've just sat there all these years listening to these things going, this has got to be a horrible way to live. And so you're saying that there's a much better way for diagnosis and there's a real legitimacy behind this now.
Yes, there have been studies that have looked at fibromyalgia for years, but really over the last 10 years, it's been really exciting research that we now know, for example, that there's a genetic component. There's actually a genetic defect in one particular chromosome that puts people at risk for fibromyalgia that you don't find very often in people who don't have fibromyalgia. And you especially see this in families where you have multiple cases of it. But the imaging where you can actually see it is kind of cool to look at. Have you ever seen scans of the brain, pictures of the brain where they're all different colors? Like in a magazine or on TV?
I actually study that. Mm-hmm.
Yeah, so that type of scan is, as opposed to the traditional CAT scan or MRI that shows what the brain looks like, those scans are showing what the brain is doing, or more specifically, how active different parts of the brain are. For example, if you put someone in a SPECT scanner and you have them doing a math problem in their head, it will light up differently than if you have that same person spelling, long words in their head, and that would be different than if you asked them to give you the directions to their home. So the brain lights up differently depending on what it's doing. Similarly, the brain lights up when someone is in pain. And we now know this. And people with fibromyalgia, that part of the brain that lights up, and those, let's say you have, rheumatoid arthritis or a broken bone or something, that part lights up. So even though you don't have a big swollen joint or a broken bone, that part is lighting up, telling us that in fact there's dysfunction within that part of the brain, it's called the midbrain, and it's sort of like the on-off switch for pain in the body. It also regulates sleep, which is a huge problem in these people, and it regulates some other things as well, like sensitivity to hot and cold and things like that. And these are all symptoms that people with fibromyalgia have: sleep problems, problems with diffuse pain, problems with feeling hot and cold, and headaches. All these things are regulated by that part of the brain. And, this on-off switch, the problem with fibromyalgia is that it's always turned up. It's more like rather than the on-off switch, it's more like the volume control on your, a radio or something like that, where it's cranked up too much. And in fibro, it's cranked up. So even, the simple handshake that shouldn't bother anybody, for a person with fibromyalgia, not only does it hurt, but it hurts long after the handshake is done. I call fibromyalgia the disease where even hugs hurt.
Wow.
I got that actually from a woman who was a grandmother. She was actually a fairly young grandmother, but she told me that's how she described fibro. She said that fibromyalgia to her meant she could no longer take a hug from her 5-year-old grandchild because it hurt too much. That's terrible, to feel that much pain, that some people, even just the wind brushing against them hurts them, and it's because, again, that part of the brain is just raw. It's just hyper sensitive. That is why they feel the way they do. There are other abnormalities as well, but that's one thing that has been documented among many others that proves that these people are not faking. There is real disease there.
Wow. Now I'm going to throw out another myth that I've heard about fibromyalgia, is that it only shows up in people who were abused, and so it's a psychosomatic response to the trauma in their lives.
Well, no, actually the largest general population study ever done actually looked at, different, past traumas and things like that. I can tell you with confidence because I was the one who did it. We actually interviewed more than 3,400 people, and we found that though there was a percentage who had a history of past trauma, whether it was abuse or sexual abuse or physical trauma, two-thirds did not. And there are many different ways that fibromyalgia can come on. The way I think about the cause of fibromyalgia is this way. Have you ever heard of carpal tunnel syndrome?
Yes, right.
Yeah, so carpal tunnel syndrome, that's where you get numbness and tingling in the hand. You might have pain in the hand. And it's caused because of irritation of a particular nerve called the median nerve, which runs through the wrist. Okay, so it's irritation of that median nerve that causes of these symptoms. Now, there are many ways to get irritation of that nerve. You can get it if you break your wrist and you injure the nerve directly. There it can happen. If you just have repetitive minor trauma, like baseball catchers or people who use jackhammers or people who just do a lot of typing. We used to say on the typewriter, but that doesn't apply anymore. So on the keyboard,
right.
So they can get it. Women during pregnancy can get it because they retain fluid, and if it retains fluid in the wrist, that can increase pressure in the wrist, and that can irritate the nerve. Now, interestingly, they've never seen it in a pregnant man.
Well, that's
interesting. They've never seen an pregnant man. But anyway,
first I think
also
they'd have to
people
find
with
a
low
pregnant
thyroid,
man.
they can get it as well. So my point is that there are many different pathways to get to that irritated nerve at the wrist. But ultimately, that's the door you have to pass through to get carpal tunnel syndrome. And I think with fibro, it's similar. There are many different ways to cause this disruption of that part of the brain that regulates pain. It can happen with a sudden trauma. It can occur because of a flu-like illness. Some people get it after surgery. Some people it just happens spontaneously. But whatever way it happens, that's the final door people have to pass through to end up having the diffuse pain and tenderness and other symptoms that are fibro. This disruption of that part of the brain that regulates pain, this dial that's just revved up.
Wow, that's interesting. And so, before I get into this any deeper, just real quick, what's the best way for people to get your book? And tell me what your book is about. Because if people want to really understand this diagnosis, and I'm going to ask you those next questions, how do you know this is you? Next, but what's the best way for them to reach you?
All right. Well, the book is called Breaking Through the Fibro Fog, Scientific Proof Fibromyalgia is Real. And it's available, you can get it really anywhere. There's worldwide distribution. It's selling in all 6 continents. But probably the easiest ways to get it is to go to, either you can go to my website, which is www.thefibrofog, F-I-B-R-O-F-O-G, so thefibrofog.com, or you can go to Amazon.com, or you can just go to your local bookstore, and if it's a large enough store, they can order it if they don't have it on the shelves. Like Barnes & Noble carries it, and Baker & Taylor carries it. So Ingram carries it. So all the major bookstores should either have it on their bookshelves or be able to order it.
Wonderful. That's good to know. And so here's my next question.
Mm-hmm.
I'll start with a little bit of a story about myself. I have a seizure disorder. And when it was at its height, if you will, it's pretty mellow now, but when it was at its height, I would have, my muscles would be so sore all the time. And I still do have a chronic muscle tension problem in my body. And so, but I remember my kids would come over, and if they gave me a hug and they, did the side hug and they put their arm around me and they'd squeeze my arm like they were hugging me, I would be like, ow, and they'd be like, Mom, what's wrong with you? I'm like, well, that hurts. And they're like, you're kidding. And I'm like, no, I'm not. And so, I was seeing a chiropractor. At the time I had moved to a new area, and saw a chiropractor, and she said, this was her first visit with me, and, she's, pushing around on my spine and different things. I'm like, ow, 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 ow. The whole time she keeps touching me. And I said to her, I said, this really does hurt. And she says, really, that's interesting. She says, I'm afraid you might have the F word. And here I'm thinking she's going to swear. And I'm like, what's the F word? Because this is kind of a strange thing. Why would I have the F word? And she said, fibromyalgia. And so in the end, I think she ruled it out that I just have chronic muscle tension from the seizure disorder. But it was just very interesting, to be thinking about that, knowing that I have a relative who's really struggled with these things. And sitting here going, this is a very interesting diagnosis. Is that what it feels like? Like when, I would go to an exercise place and stretch and work out in the gym, I can usually make it about 3 weeks before I'm in so much pain that I can't handle it anymore. Yeah. And everybody's like, no, you go to the gym, you work out, you get pain, and you push through that and you feel better. But I get worse and worse, and then I start having seizures again. And so I can't push past it. We've learned over the years that I cannot push past it. So going to low impact aerobics and those things for me is just really a very poor idea. It's not a wise choice. And so, things like this make me wonder, do you have it, do you not? And I'm sure people are out there listening going, well, I've heard of it, but how would I even have a clue if it's me?
Mm-hmm. Well, you brought up several really great points with that story. First of all, I'm going to tell you that you're not alone. Other people I have seen other people who have come in with various other conditions where they've had, for example, seizures, or people who, this is actually a very common scenario where people will have a stroke involving that part of the midbrain, and they'll have fibromyalgia, but then the stroke will sort of pass and then it'll go away. So you can have people, if there's a local injury to that part of the brain called the midbrain, whatever it is, that can cause you to have fibromyalgia, at least for a period of time that the injury is there. When you have a seizure, of course, you've got diffuse electrical activity going on throughout the brain. One part of the brain, wherever the seizure focus is misfiring repeatedly, but that can potentially affect other parts of the brain as well. So that may have been what was going on, is you were sort of resetting that part of the brain. So that's the first point. The second thing is you mentioned exercise. And this is something that for many years, physicians and researchers, and certainly most people, have thought that fibromyalgia is a muscle disease. I mean, the word fibromyalgia actually means pain in muscles and fibrous tissues like tendons and ligaments. Myo refers to muscle. So
right.
The name muscle is right in the name. So everyone thinks that it's a muscle disease, which means, okay, all you need to do is just strengthen your muscles and you'll be great. But the problem is that it's not a muscle disease. It's a brain disease. It's a disease of that part of the brain. And if you push your muscles too far, you can actually start to, again, if you're starting to trigger the pain response, you can actually amplify that pain response, and then the cycle just sort of starts up again. So I've always told people with fibromyalgia, when you start exercise, you have to really start with start low, go slow, really, really low. Some people, I used to tell them, all you do is for the first 3 weeks, all you do is just change into your gym clothes and then change out of your gym clothes, and that's fine. That's enough. Just get the habit. You develop the habit. It takes 3 weeks to develop a habit. So you do that for 3 weeks, and then after that, once you have the habit down, then you start, driving to your gym and looking at it, and then driving home. Whatever it takes to develop the habit, and then very, very slowly you start building up the exercise. But once you have fibro, there is no fibro Olympics. We're not going to have a competition for that. So you just have to do what's right for you. But you have to start very low. And many people with fibromyalgia find that they can't push past a certain point because then it just gets worse. I'm not saying you have fibro, but again, you may have a very similar process going on, that whenever your seizures are active, they are causing that part of the brain to be just reset abnormally. Plus, of course, the muscle tension can affect it as well. That combination just makes you, really diffusely tender and sort of like behave as if you have fibro, when in fact, once everything settles down, it may go away. And some people actually, another myth is that fibro never goes away, but in fact, although most people will have it long term, in the study we did, where we followed people long term, we found that about 2% every year went into remission, which means that over 10 years, 20%.
Wow.
It's much better among children, though. Children have a much better response and course long term than adults do. It's about 70% of children will go on to achieve remission by the time they reach adulthood. So it's much better for children.
Now, I'm presuming that you even recognize this in a child, and what would it look like in a child?
Well, yeah, and again, a wonderful point. So many doctors wouldn't even think of fibromyalgia in a kid. They wouldn't even think of it in a child. They think it's just an old woman's disease, right? But again, it's the old woman's disease that even kids can get and men can get. In one study that was done in Israel, roughly 1 in 20 children in a grade 8 class met the criteria for fibromyalgia. They had disrupted sleep. They had diffuse, they just were really tender all over the place, and they had lots of aches and pains that came and went. They were very tired. I mean, just think of yourself, how many teenagers does that describe, right? Who are just tired all the time and disrupted sleep patterns, right? So they're prone to this, and it can really adversely affect them because, of course, the teenage years are so important in terms of, what they're going to be when they grow up, but also their social interactions, whatever. So it can be really devastating. But if you're a parent, let's say, or a teacher, if you have a kid, can be at any age, even younger than age 10, they can get it. But if you have a kid who's just, tender, doesn't want to be touched, doesn't want to be held, doesn't want a hug, or it was really active in sports and now just is dropping out of sports because they're hurt all the time. They used to be fine, but now they miss half the season every year because they're hurt. And they fall, and it doesn't look like a big fall, but they're out for 3 weeks. If you start getting that, especially in the setting of a lot of tiredness, a lot of fatigue, and really bad sleep, that's when you have to start thinking of fibro, and they need to be examined for it because it does exist in children.
Now, who would you go see about a diagnosis for this? Now, I would think you would see a chiropractor, but a lot of people don't know chiropractors and wouldn't even think chiropractor is their first response. They think they're primary care physician.
Well, the thing, it all depends on the primary care physician or the chiropractor, whoever, and how familiar they are with fibromyalgia. I mean, there was again another study that was done here in Canada where they looked at. They surveyed family doctors and pain specialists and psychiatrists, and only about one in 4 frontline physicians believed that all these patients were faking. So if you happen to have one of the family doctors who doesn't believe that fibro even exists, then don't go there. It's not going to help you. Right. You're kind of wasting your time. The 3 hours in the waiting room ain't worth it. Right. So. Right. So. But there are other doctors who are much more familiar with it, and in fact, there's a lot of research that's being done now on fibromyalgia in children. So pediatricians, especially, are becoming more and more familiar with fibromyalgia in children. So, from a physician standpoint, if you've got a really great family doctor who just is really up on things, then okay. But otherwise, you may require being seen by a pediatrician in terms of physicians. In terms of other healthcare providers, again, I don't know as well because I'm not one, but I can tell you that again it relates to how attentive they are to you. I think one of the things that has hurt traditional physicians in the past is that we tend to, spend 40 minutes examining you and then 1 minute providing a solution. And if it works, great, and if it doesn't, you need another prescription in 5 months.
And even now, I mean, it's really changed. The doctor comes in, you give the list to the nurse of your ailments, if you will. They leave the room. The doctor comes in and spends 15 minutes with you, and 3 of those or 2 of those minutes, as you're saying, is this is how we fix it. Here's a prescription. And because I brought my granddaughter to her doctor the other day, and they were nice, but the gentleman was just like, okay, here's the solution, and it was a genetic issue that we struggle with in my family regularly. My granddaughter, unfortunately, is the 4th generation of this problem. And I just looked at the doctor and said, I'm sorry, that doesn't work. I mean, They told me that, 40-plus years ago, and it didn't work for me. And they told me that for my daughter, and it didn't work for her. And I was hoping that today you guys would have a new newer, more modern medical way to deal with this, because this is a genetic disorder and it's getting worse throughout the generations, and there's got to be something. And when I said that, he goes, oh, really? And I'm like, yes. So if it didn't work for us, why are we putting it on her? You know, and we've been doing that for over a year, and it still doesn't help.
Yep.
And he was wonderful. He was absolutely wonderful. Of course, I was very respectful, and he did give us other solutions. And now they're going to actually try to do some ultrasounds and whatever type of scans and things to see if there isn't, a problem physically in the muscles, the joints, and the areas that aren't developed right or didn't work right. Because they didn't have those options when I was a kid.
Sure. Yeah.
And so now it's very different. But, sometimes you need to go in there. If you think your child has fibromyalgia, you might want to go in there with a list of symptoms and a little bit of information. And I know that WebMD is often used by nurses and doctors themselves. I know quite a few RNs who work in the emergency room who are using WebMD. So if you're out there listening to us today and you're thinking, I don't know, maybe this fibromyalgia thing is an issue that my kids are having and I haven't even thought of it, or maybe for myself, go look at the symptoms, and if you don't think your doctor is aware of it, bring the article in and let them look at it. It's possible that they'll learn something right along with you, and most doctors are willing to help treat their patients, and I really have found that. They really do want to find a solution. They just may not have all the answers. And if you've got a list of symptoms there and say she has this, and this, then you can give them a better picture of what's really happening.
That is such a wonderful point. I always tell patients that the best way, because as you said, doctors are very rushed. I mean, here in Canada, doctors are very rushed. Sometimes you only have a few minutes with them. So the best way to make productive use of your time is to come in with two lists, your list and their list. And it's the same list, but you've got a copy so you know what's on your list in case you've forgotten. But you hand one to them. And the reason that helps is that they can immediately see the whole picture. Because sometimes they'll get bogged down on one thing, and just as they're done with you, and you haven't had a chance to report to them that, oh, by the way, you're having chest pain, or something else, your leg fell off in the parking lot. So you have to, if you've written it down and they have a list, they can look at it and they go, oh. In 2 seconds, they have a global picture of this. The second thing you put on your list is your questions, the questions you have. Now, questions will come up as they're talking. That's fine. But make sure that if you have some questions beforehand, you have it on both your lists so you don't forget and they don't forget. And the third thing is, I always recommend this, have a second person with you. Now, if it's a kid, the parent's going to be there. If it's an adult, having a partner or a friend or somebody who you really trust in there, sometimes to help, because you may forget what the doctor has said or not quite understand it, but then you have someone to talk to afterwards. And then, as you mentioned before, doing a little bit of Google searching beforehand, not to scare yourself. Don't, because it can be scary. You go, oh, my God, I've got 3 minutes to live.
We're all going to die.
This had better download quickly. I've only got 2 minutes left. But, but you have to be able to look, if you can find some general information, then you can come in and that can help you formulate your questions. And then, of course, so those are sort of like 4 big tips. Bring a list in with your symptoms, 2 copies, 1 for you, 1 for your doctor. 2, have questions on that list. 3, bring a friend or have someone else with you. 4, go prepared. And 5, you mentioned it as well, be respectful. Once it becomes, once animosity creeps up, if that's going to happen, then you pretty well need another doctor. You're not going to get your solution there.
Right. If you go in with that whole attitude of, I know I'm right and you're wrong, but I have to come here, because a lot of times you have to get a referral from one doctor to see another doctor, that really does throw the doctors off. I mean, they're humans too, and if I walked into your house and said, you're bad at whatever it is that you're doing, you'd be put off your guard as well. And as soon as someone's guard's up, their ears are off. Their listening skills really drop
and
out.
They stop. Then they're thinking about how to defend themselves against you rather than how to help you. So that's very important. You also asked something about who should you see, and we've only talked about physicians, but in terms of other healthcare professionals, one thing that I think they really bring to the table that doctors tend not to is, let's say you go to a physiotherapist or a chiropractor. What do? They collect a bit of information, but then they start treating you, and they're actually touching you. So they are continuing to gather information as they treat you, as opposed to the doctor who sends you home with a pill.
Right.
If it doesn't work, then you see them next time, oh, I guess that didn't work, we'll try this. Now, they may order some blood tests or x-rays that come in that help, but for most people with chronic pain, they don't help, these other things. So that's one big advantage of physiotherapists, chiropractors, whatever. I always have said that a really good physiotherapist makes a bad doctor look good. And I will say that with every ounce of my heart. If you can find a really good therapist, whether they're a physiotherapist or occupational therapist or some other non-physician like a chiropractic physician, I don't want to, rather than traditional physician like a chiropractic physician, but one who uses manipulation, who's actually touching you, you can gain a lot of information, and they can gain a lot of information from the action of treating you, where the doctor who's giving you a pill doesn't. And many people with fibromyalgia don't tolerate medications that well. And in children, there are many medications that can't even be prescribed. So especially if you have a kid, maybe you don't want them on medication. And there are many other treatments that can be used for fibromyalgia that don't involve medication. It's very individualized.
What are some of those treatments? I mean, if people are going to a doctor and saying, what's the hope here? I need some kind of hope. Is there something we can do? I mean, what are some of the things that maybe they can do at home or that the doctors can do with them?
Well, there are a few things. First of all, I tell everyone that the most important part of treating fibromyalgia is to take some ownership for what you can do to help yourself, because the more you can do for yourself, the more control you have over your own health care. You don't have to rely on the physician. Some physicians retire, or they move, or something else happens, or they just get so busy they can't see you, or they're on pregnancy leave, or other parental leave, or whatever. For whatever reason, they become unavailable. If the only thing you can do, or the only thing you're doing for your fibro or whatever condition you have is what that doctor is prescribing you, then you're at that disadvantage. So the more you can do for yourself, the better. Beyond the second thing I'm going to say is that the treatment of fibromyalgia, as many things, is very individualistic. What works for one person may not work for another. But I'll tell you the most popular treatment, and there was a big survey that looked at this, to find the treatment that most people feel helps with fibromyalgia is massage, actually. Mm-hmm. Now, that doesn't mean that everybody responds. Some people can't even tolerate it because, again, there's that tenderness thing, right? But overall, massage is probably the most likely treatment to help.
Okay.
Exercise also can be very helpful, but again, you have to start low, go slow, and ridiculously slow and ridiculously low. You can say, the temptation is to say, running around the block, it's only one block. Well, that may be way too much for you. The point is you don't want to start developing pain before you've developed any of the habits, because then you'll just stop.
Right.
And in fact, you want to minimize the pain. You don't. It's not like, bodybuilders where they go there where they're pushing till it hurts, and then when they start really hurting, they go, oh, that's great. You don't want that if you have fibro, because again, your pain is amplified.
No pain, no gain theory was what I was always taught. Because I was, of course, raised
not with
by
fibro.
Yeah, I was raised with wolves, but they were actually brothers. And and they used to say things like that, no pain, no gain. And the thing is that, that worked when I was young, but after my seizure disorder really took over, it was very different. I mean, I have, my husband the other day said, well, I really would love to go back to the gym, and he goes, don't even go there. And I'm like, I'm sorry. He's like, because every year you go there and you do about 30 days, and after 30 days, your seizures increase severely. You're in so much pain that you can't sleep, you can't walk, you can't anything, and you just don't get better, and it takes you almost 6 weeks to recover from 30 days of trying to go to the gym. And and I'm like, I know, okay, So I found that what works well for me is swimming, but I don't do like something you would see in the Olympics. I just do very slow gliding. And then, and I back float and front float, and I do a lot of real soothing type movements, and I've actually found that I can do that 3 times a week and be okay. But, a lot of the other people in the lanes are lapping back and forth. I'm just like moseying along. Sometimes I just walk and just actually just stretch, and that works out very, very well. It's very, very gentle, and I don't feel I don't get into that big pain thing, because you're right. Even if I don't have fibro and I still have this chronic muscle tension issue, once your muscles start hurting, I mean, it's bad.
Yeah. And again, you brought up another wonderful point. It's very tempting when you're in a setting where there are other people exercising to try to keep up with them. Low impact aerobics. A lot of people love lower impact aerobics or even things like Tai Chi or things like that. But then they join a class and they think, okay, well, I'll be in this class and it's really gentle, and the leader of the class says, oh, this will be really easy, and they'll push it, and then 15 minutes, or 5 minutes in, they're going, oh my, this is awful. But they feel like, oh, I've got another 45 minutes to go. I don't want to wimp out now. Wimp out now. As a matter of fact, don't do it at all. If you're going to go into an exercise class, make sure that you go talk to the leader beforehand, before you sign up, and say, is this geared for people, or do you have a class for people who have fibromyalgia or chronic pain? Because then there will be other people who are backing out too, first of all, and secondly, hopefully it'll be toned down a notch. Also, exercises you can do at home. There are videos you can get that where you can exercise at home. I recently met a woman whose name is Jeanette DePatty. She calls herself the Fat Chick. And she's written a book and a video where she specifically has an exercise program designed for people who are, who can't keep up with the traditional exercise. So, if you can get a video for home, and you can just do it in front of your TV, then when you're tired, you just back off. And if they say, well, let's do 10 reps, if 2 reps is all you can do, perfect. Just do that. Don't go beyond it. Develop the habit first, even if it is just sitting down 3-4 times a week and watching the video for the first 3 weeks. I don't care. That's good. That's better than doing nothing. Then once you get, as a matter of fact, it's not a bad idea to do that the first couple of times. Just watch it. Don't try exercising at all. Just watch it so you get a sense of the scope of this exercise. And, so you can then plan, I'm going to pace myself. I'm going to do this first exercise. I'm not going to do the second exercise. I'm going to do the third and the fourth, and then I'm going to cut out. That's fine.
Right.
You do whatever you need to do. But no pain, no gain doesn't work with fibro, because, again, that switch is turned all the way up. And once you get that switch really aggravated, then it amplifies further.
Yeah. Well, and I think I'm just really hearing you because, you know, my husband was in the military, and he also, of course, did that. He doesn't do it with me, but he does it with himself. And and he'll push, and he'll be like, you know, he was a runner as well, and so he would say, you know, yeah, my muscles would burn, but you would just run and you would get through it, and then at the end of the race, you know, you really felt good. And my muscles burn. I don't get through it. It doesn't go away. You know, he could actually push through it. So for him, this is really a muscle, you know, for him, I'm thinking it's really a muscle reaction. And for fibromyalgia, it's a brain reaction. It's a brain problem, not a muscle. You know, I'm not breaking down my muscles and rebuilding my muscles. I'm turning on something in my brain. And so it's really very, very different, even though it might look the same on the outside to somebody who's not aware of how this diagnosis works and what happens.
And now your husband, you said, is very supportive, and that's great. But I'm just going to tell you, if ever you hear another runner who says that, you know, well, just push through it, and you say, okay, try this. Next time you go on your daily 5-mile run, be sure to wear a size of shoes that is like a pair of shoes that are 3 sizes too small. And then see if you can push through it. And if you think that's a good idea.
Right, yeah.
Because, of course, the further you run, the more it's going to hurt. By the time you finish, your feet are going to be so sore and raw and scraped up that you won't be able to run at all the next day. That's the way to think about it. It is not the same when you have fibro. Things will get worse. Just like running, 5 miles in shoes that are way too small for you and your feet are all cramped up, that won't help you either. So the exercise, yes, it can be helpful. You have to start really low, go really slow, go at your own pace. Don't go at anyone else's pace. It's for you. It's very individualistic.
Right.
Mm-hmm.
Well, now, besides that, is there anything that besides exercise, what else? We've only just got a minute or two here. What is one other thing that maybe, if I'm looking for fibromyalgia in a child, or if you want to say another thing that maybe we can do at home that might just help us out?
Well, I think the most important thing is to support your child. I mean, you're going to get as much information as you can, but just recognize that, how difficult it is for children to be sick. It is very difficult for them in many, many different ways, especially during the teenage years. I remember I've talked with a woman who was 17 years old. She was going into her senior year of high school. This was supposed to be the best year of her life. And following just a minor injury, she basically just bumped her hand. But she developed chronic pain that then spread up the arm and ultimately into the back. She ended up missing half of her senior year. She didn't graduate with the rest of her class. It just absolutely devastated her. What saved her was the undying support of her parents. The undying support of her parents. She ultimately wrote a book about it. And, if there's one thing, that the most important thing, I think, if you have fibro or any other poorly understood illness, is to have people believe you and support you. Everything else is trial and error. There are herbals that can be helpful. There are, medications that can be helpful. There's pool therapy, hot tub, massage, exercise, Tai Chi, other things, meditation. All of this can be helpful. Something called behavioral cognitive therapy, where biofeedback. These are all things that can be helpful, but have to be tried individually. Some will work with some people, not with others. But the underlying premise is that you have to have someone, or hopefully more than one person, in your corner who is your champion, who is going to be there for you no matter what. And they have to believe you. And
I think,
that's what I try to do with my book, was to increase the number of champions out there so that there's no longer any doubt that fibromyalgia is a real physical illness and not just depression, not just anxiety, not just acting out, not just hypochondria. I mean, how scary that must be to have an illness like this and have your loved ones not believe you.
Right. Yeah, and I think that's the only reason why my relative who struggles with this does well is her spouse is absolutely supportive, and he's never once listened to the other people who were uneducated in this area, and you know, it's why they made it. They've been married, gosh, I think like 30-something years or maybe even closer to 40, and that's why, because, you know, he's just been absolutely supportive of her. And so, you know, this is a good thing as we're closing out this show today, is, you know, regardless of whether you or your family has fibromyalgia, if you take anything away from the show today, it is listen, really listen to your family members, listen to your children. If they say when you hug me it hurts, instead of saying, oh, that's ridiculous, come here, and you give them a bigger hug. Now, that one hurts, you know, and you give them a tighter bear hug, and the kid's like, no, really. You know what? Don't do that. Listen to your children. Hear what they're saying.
Exactly.
And assume that they are telling you the truth. This is the one time that little, you know, make the blank out of you and me is not true for this word. I mean, just trust that they're telling you the truth. Most children aren't lying when they say, I hurt. Even if you can't see it, they can still feel it. So, last thing here, just give us real quick, Dr. Kevin White, how can people best reach you and get a hold of your book?
Well, again, the best way to reach me is through my website, and you can also order the book there as either a printed book or as an e-book. And the website is www.thefibrofog, that's F as in Frank, IBRO, fog, FOG.com. You can also order it through Amazon.com or just go into any local bookstore, especially a larger store, and if they don't have it on their shelves, they can order it for you.
All right. Well, Dr. Kevin White, thank you so much for being a part of our show today. And for those of you who are listening, go ahead, get hold of him, thefibrofog.com. And thank you for being here. They can email me from there, too. They can email me from that site, too. If they go to the site, they can send an email. And I have a great blog page, by the way, there, and there are videos. If you want some funny videos, I have lots of funny. I'm a bit of a closet comedian, so that all comes out. I'm a musician as well. You can even find me singing on my website. So if you want a good laugh, you can go there and entertain yourself, if nothing else. All right. So if you need education on fibromyalgia or you need a little bit of humor in your world today, go ahead and go to thefibrofog.com. All right, everyone. Thank you for being here. We will see you next week where we are going to be talking about safe teen drivers. Did you know that there is a way to really prepare your teenager through a video game? Really, it's true. Not the ones that you see that most people, but a real video game that teaches true safe teen driving skills. So be with us next week, and we will be speaking to Bob Ragazzo, the safe teen driver. All right, we'll talk to you later. Have a great week. Bye-bye.